A very good evening and a warm welcome to the ceremonial induction of the 127th President of the Sri Lanka Medical Association, coming to you live from the Bandaranaike Memorial International Conference Hall. Before we formally commence the proceedings this evening, let's take a few minutes to listen to the audio on health and safety measures compiled by our host, BMICH. Keeping in line with tradition and culture of Sri Lanka, may I call upon the following dignitaries to mark the commencement of this historic occasion with traditional lighting of the oil lamp. Dr. Padma Gunaratna, the incoming president of the SLMA, Professor Indika Karunatilaka, the outgoing president of the SLMA, Professor Samath Dharmaratna, the president-elect of the SLMA, Professor Sudarshani Vasalatantri and Dr. Manilka Sumana Tilaka, joint vice presidents of the SLMA, Dr. Sumitra Tisera, the secretary of the SLMA, Professor Asela Olupeliava, the treasurer of the SLMA, Dr. Lakshman Ranasinghe, the representing past presidents of the SLMA, Professor Arjuna Aluvihare, consultant surgeon representing teachers, and Mrs. Pradeepa Samarasinghe, the principal of Devi Balika Vidyalaya Colombo, the alma mater of our incoming president. Now I would like to invite Professor Indika Karunatilaka and Dr. Padma Gunaratna to grace us at the head table. Thank you. You may take your seats now. Once again, a very good evening and a warm welcome to the ceremonial induction of the 127th President of the Sri Lanka Medical Association. May I now invite Professor Indika Karunatilaka, the outgoing President, to address our esteemed gathering.
Dr. Padma Sriyani Gunaratna, the incoming President of Sri Lanka Medical Association, patrons, past presidents, council members and members of Sri Lanka Medical Association, distinguished invitees, ladies and gentlemen who are joining with us this beautiful evening in person as well as online. Very good evening to all of you. At the very outset, let me thank all of you for the singular honor bestowed upon me by permitting me to serve you as the 126th President of Sri Lanka Medical Association during one of the most challenging years of our motherland. Therefore, it would be pertinent to reflect upon the goals that we have set during 2020 and to learn from them. The declared vision of Sri Lanka Medical Association for 2020, the SLMA 2020 vision, was professional development for quality enhancement in healthcare. This was declared during the induction of 126th President with my induction in last year at the PGIM. And with this vision, there were 5 objectives that we pledged to achieve during that year. They were namely, first, education, lifelong learning, and continuous professional development. Enhancing the delivery of healthcare through system improvement, innovative application of technology, health promotion, lifestyle modification, and finally, collaboration and teamwork. Let's reflect upon them one by one. Education, lifelong learning is one of the main objectives of Sri Lanka Medical Association, and also personally being a medical educator, this is a priority area for us. However, the objective to fulfill or the opportunity to fulfill this objective came in the most unexpected way. When the last council took over the responsibilities, COVID-19 was only in the horizon. It was only appearing to state in the news lines. However, SLMA was very quick to action. And on 30th January 2020, Sri Lanka Medical Association organized and conducted the first ever national seminar on COVID-19. Again, I would like to highlight that this was even before the first Sri Lankan patient who was infected with COVID-19 was detected. And this was held in the historic E.M. Vijayarama Auditorium of Sri Lanka Medical Association. And many of you could remember that the auditorium was filled to the brim, because this was so timely activity. And I must thank the infectious disease expert committee, especially Dr. Kalyani Guruge, Dr. Lushan Jayasuriya, and several others, Dr. Ranjit Pereira, and many other members. And with their encouragement, we thought this is a time we have to move in quickly, because at this time period, no one really knew much about COVID-19. And the interest level was very high. And during this timely webinar, we were able to get the expert opinion and learn a lot of new things and important facts about this incoming challenge. And what followed there onwards was a series of professional development and health education activities, including mass media and the New Look news magazine of Sri Lanka Medical Association, again, took this as a priority. The February issue of SLMA news magazine, the theme was COVID-19, are we ready to face? Again, a very timely theme, and a lot of important information, even during that time, was shared related to the basic science, the virology, or the preventive measures, so on and so forth. And it continued with a series of news magazines focusing on important areas such as high-risk groups and the multiple stakeholder involvement. Based on the success of first seminar, and which was a webinar as well, it had to be conducted as a webinar because the participation was so much, and the space that was available within the Vijayarama house was not adequate to serve everyone. Therefore, at the same time, it was the first time that we have conducted a CPD activity or a health education activity as a webinar on Zoom platform. Again, what followed was a series of webinars discussing different aspects that are related to the epidemic. Many were conducted in line and along with the collaboration of several colleges and associations. The most important activity of the annual calendar of Sri Lanka Medical Association is the Anniversary Medical Congress, or as it was known in the past, the SLMA sessions. This time, initially, there was a concern whether we can have it. Again, what the council decided was, we should, as the National Medical Association, we should set an example and we have to show the way. So therefore, we have decided to conduct the 133rd Anniversary International Medical Congress of Sri Lanka Medical Association in line with the new normal as a hybrid online conference with the appropriate theme, professional development for quality enhancement in healthcare beyond COVID-19, which was conducted with all the components of the conventional conference with a higher participation. A record number of 800 participants registered for the conference, which was considered as an academic conference in the new normal. And since then, again, a series of health education activities conducted through print media and mass media. And what resulted in from all these online activities, webinars and seminars were a massive amount of high quality education material, an amount that we couldn't combinedly develop during last so many years, because this time we have to move into that at a rapid pace. And based on that, we were able to develop and populate the SLMA online CPD portal with all the relevant areas, courses, modules, completely populated with content material. So, in a way, the epidemic that has led to all these activities has become a blessing in disguise to reach the objective of continuous professional development. The challenge of COVID-19 made it imperative that we had to make the maximum use of technology. So what were the achievements related to the innovative application of technology? In March and April, again, when the lockdown was in force and there were several movement restrictions, we felt it would be very appropriate to share the experiences of the region. And during that time period, organizing an event was a challenge because it was basically lockdown and curfew. However, what we thought was, based on the success of our webinars, we have conducted our first online international conference with the Asia Pacific Academic Consortium for Public Health, which I happen to be the Vice President. And with their collaboration, we shared the experience of controlling COVID-19 across the region, including Sri Lanka, Malaysia, Thailand, Hong Kong, China, so on and so forth. A hugely successful conference which has given us insights about how correctly Sri Lanka was managing the situation during that time period. Not only that, during this time period, we have conducted many conferences. Another historic conference to mark the 150th anniversary of the Colombo Medical School, again conducted as an online event. The historic E.M. Vijayarama Endowment Lecture was conducted as a hybrid online event for the first time. Similarly, the foundation sessions. Here, SLMA has actually been a trendsetter because during the initial time period, it was a new ground for all of us. It was easy to conduct webinars. It was easy to conduct face-to-face meetings. However, combining face-to-face with online was a huge challenge, which no one has reached into. Once we have successfully conducted, many colleges and associations has taken the lead and now conducting several successful online hybrid meetings. So we can be very happy that SLMA has been a trendsetter. This is the era of social media. And during this challenging time period, we have maximally utilized the social media. So much so, the initial membership of 9,000 has grown up to 25,000, being the largest health professional social media page in Sri Lanka and utilizing it to the maximum effect to reach the community, to provide up-to-date, correct information related to COVID-19 through the expertise. Same with other social media such as Twitter and also the electronic media, including YouTube, which has now reached 1,000 subscribers, and within 1 year, over 500 high-quality videos were developed and added into those platforms. Another landmark event in technology was the APAC 2020 conference that was conducted in December 2020 in collaboration with APAC, Faculty of Medicine, and SLMA. And perhaps this may be the first time in the history in the history of medical conferences that the conference was conducted combining the face-to-face video conferencing, online meeting, as well as the 3D virtual and augmented reality. So a lot of new ground was there, and SLMA has become a trendsetter. Now we can see several international conferences are conducted in the same way. Healthcare system, again a very important area, and from the very beginning, SLMA has been playing an advocacy role, and during the COVID-19 period, it was pronounced. During the time period where the situation was not very clear, SLMA, with the expertise of Vice President Professor Veera Singh and several other scientists, was able to come out with the accurate prediction during the first wave of COVID-19. And as you may remember, there was a time period where there was an argument. What should be the diagnostic test for COVID-19? And there were many proposals for the rapid antibody test. At this time, SLMA came forward with the expertise and collaboration with the College of Physicians and College of Microbiologists. We came up with a proposal that was submitted to the Ministry of Health that RT-PCR should be the diagnostic test and the capacity should be increased. And that was a landmark event related to COVID-19 control in the country. We strongly believed that the control of this epidemic is multi-stakeholder. Therefore, we have conducted a series of webinars with several stakeholders representing different specialties. For example, like law enforcement, hospitality, legal, so on and so forth, and getting their opinion and discussing how we can get the community engaged and empowerment. As you may agree, this is one of the most important and maybe one area that we have to really improve, how to get our community engaged and empowerment to break the chain of transmission. And several webinars, and one which was conducted as a pre-conference workshop was actually focusing on the future of medical education, another historic meeting where all the medical deans of the country come into one online platform and discuss how the medical education should be moved into new platform, which has later transformed into newspaper articles, online discussions, and journal articles. Similarly, on school education, again you may remember there were some attempts to get thermometers to all the school children before the school started. Again, the SLMA came forward and then scientifically proved the futility of that attempt. There was similar such advocacy during that time period. Similarly, again, there was one time period where the decontamination chambers were promoted heavily. Again, SLMA in collaboration with the Sri Lanka College of Microbiologists, again we have written to the authorities, and the decision makers and the political leaders finally agreed with the SLMA's stance and then decided to move away with the decision to use the decontamination chambers. When the second wave came, again we studied the situation and conducted several stakeholder meetings and webinars and written to media and HE, the president, related to the situation. Not only that, we have went to the practical or the ground field situation also in collaboration with the Ministry of Health, Again, lot of support from Dr. Professor Krishanta Veerasinghe and several other council members. We have conducted a situation analysis in Gampha district and proposed that with that situation, the hospital system will be very soon overwhelmed. Therefore, proposed to start the intermediate treatment centers for COVID-19, again, which was accepted by the Ministry of Health. So there were several areas. It's only few areas that I have highlighted where we have worked in very close collaboration with the Ministry of Health and played a leading advocacy role related to health system enhancement and development. Health promotion, another important area. In spite of the current situation, several activities were conducted, and one important landmark event was handing over the SLMA publication on suicide prevention. Again, I must thank the past President Dr. Anla Vijayasundara and the Committee of the Suicide Prevention of SLMA Expert Committee for this initiative. Finally, but most importantly, teamwork and collaboration. Because this kind of situation, you need partnerships, you need teamwork and collaboration. SLMA has worked in very close collaboration with the ministries, not only health, but education, higher education, Sri Lanka Medical Council, University Grant Commission, and very importantly, the UN agencies. One important aspect where the SLMA has contributed at national level was the National Parliamentary Election, where the Sri Lanka Elections Commission, they have identified the SLMA's leading role during this situation and requested whether SLMA can help the Elections Commission to conduct a COVID-free election, which SLMA supported. And again, I must thank Dr. Chandana Tapattu for his support and the collaboration, and Dr. Manush Veerasinghe and several others from Sri Lanka Medical Association who worked in very close collaboration with the Elections Commission to ensure a COVID-free election. And some of you may remember that the Elections Commissioner personally specifically mentioned SLMA and paid his gratitude during the official press conference soon after the election. So that was another important contribution by SLMA. And similarly, when the Paliagoda fish market cluster came up, again the Ministry of Fisheries contacted Sri Lanka Medical Association and wanted to conduct a situation analysis. We have gone into those different places and studied about the situation, because there was a myth that the disease is spread by fish and therefore the fish consumption has gone down. That's the reason that the Ministry of Fisheries wanted the support of SLMA. So there was a situation analysis where very important findings, such as how the disease will be spreading in crowded areas with poor ventilation, especially the underprivileged areas. And all these findings and recommendations were submitted to the Ministry of Fisheries as well as Sri Lanka Medical Association, the Ministry of Health. Several international level collaboration, especially with APAC and then the Commonwealth Medical Association, and leading luminaries in health, including the Director General of WHO himself, and legendary Professor Michael Marmoth, Professor Srinath Reddy, many others, Professor Malik Piris, all of us join hands with SLMA to share their knowledge and experience related to the current situation. Very important step that we have taken during last year was formation of the SLMA Intercollegiate Committee. This I considered as an important landmark achievement, because considering the difficulty, even getting a consensus between few colleges or even within a college, this was an achievement to bring together over 50 colleges together and work them towards one goal, that is control and prevention of COVID-19 epidemic. We have been working in very close collaboration with the top level, with the government and the Ministry of Health. However, our stance was based on science and science only. It was based on the strong foundation of the public health prevention, principles and prevention, and approach was science only. And there were several situations where SLMA came forward and suggested the ministry and the government that there are areas for improvement and measures had to be taken. Ladies and gentlemen, what I have taken through were some of the activities that we have conducted. I don't think it is appropriate or required to discuss all the activities that were conducted during last year because they are available in our annual report. If we go through these 5 objectives that we have set, I presume that we have achieved a lot, though unexpected way, through a lot of hard work, a lot of sacrifices and commitment. Personally, there are many I would like to thank. First, my parents, who are not with us anymore. My father, all of you may remember that he was there for the induction last year. They were the pillars of strength behind whatever success I had. And my family, my wife Sujiva, and the 2 sons, Sachinta and Lanka, I must thank them for tolerating me and supporting me during a very difficult year. The time that actually belonged to me was taken away from them. There was some period during the initial part where we had to go into several high-risk areas that I was basically living in a room that was in a separate entrance in my own home. Our council for 2020, I thank all of you for the support. Everyone, every single one of you supported in different ways. Some in a more pronounced way, some in different points. But everyone, you contributed. Dr. Sumitra Tisera, our energetic secretary, the secretary for this year as well, she was a silent worker and supported me in every way. Dr. Padma Gunaratna, the incoming president, was supportive during all the activities and was present in all the areas. There were several seniors. You may remember that I was calling you sometimes in the middle of night or even early morning. Dr. B.J.C. Pereira and Dr. Saratgami, Dr. Kalyani Guruge, Dr. Pamila Senanayaka, Dr. Christo, Dr. Lushan Jayasuriya. Thank you for permitting me to pick your brains and give your support. You are always very supportive. And the SLMA under 35 group, Dr. Kalyani Guruge, Dr. Pramod, Sankar, several others, Hasini, and all of you. I thank all the support that was given to you. So thank you, dear council. Without your support, it would never have been reality. But I should thank this group of people. They were always with me, even though I will not be mentioning the names. Those are from SLMA, from the Faculty of Medicine, Colombo, and the University of Colombo, the Department of Medical Education, and our technical partner, IME. They were always with me and supported in every possible way. And without their support, all the work that we have done during last year would not be a reality. And I must thank them for tolerating me because they know something that many of you don't know, that how difficult is it to work with me. So that they know by experience, but thank you so much for all the support that was given. Ladies and gentlemen, 2020 was unprecedented and it was an year which was most challenging for the medical profession. During such year, SLMA has rose to the occasion, has broken new ground, reached new vistas, reached higher level of recognition. It is our responsibility to serve SLMA. I wish and I congratulate the incoming president and the council, and I wish the new president, Dr. Padma Gunaratna, and her council to take SLMA to take new heights during year 2021. Lanka Dipassa Kitchesu Mapamachi. Let's serve Mother Sri Lanka without delay. Thank you.
Thank you, sir. It was indeed a challenging year. I must say that SLMA rose to the challenge brilliantly as pioneers and trendsetters in many arenas. All right, so we have a special performance tonight by an artist who needs no introduction. Ladies and gentlemen, please put your hands together for Sashika Nisansala. May I now invite Professor Indika Karunatilaka to introduce our incoming President, Dr. Padma Gunaratna.
Padma Shriyani Gunaratna ni Ranasinghe is a board-certified neurologist with experience of a specialist in neurology over 30 years. She was born in Kottawa in March 1958. She had a primary education in Dharmapala Vidyalaya, Pannipitiya, and the secondary education in Devi Balika Vidyalaya, Boralla. She entered the Faculty of Medicine, University of Peradeniya in 1977 and qualified MBBS with second class honours in 1982. She qualified the MD General Medicine in 1987 and board certified as a neurologist in 1991. She obtained her MRCP UK in 1992. She is a fellow of Royal Ceylon College of Physicians, Royal College of Physicians, London, College of Physicians and Surgeons of Glasgow, Royal College of Physicians of Edinburgh, American Association of Neurologists, Royal Australasian College of Physicians, and a fellow of the World Stroke Organization. She commenced her specialist appointment as a consultant neurologist at the Teaching Hospital Kandy in 1991 and worked over 13 years there, following which she moved to take up the post of senior consultant neurologist at the Institute of Neurology, National Hospital of Sri Lanka. She held this position for 14 years till her retirement in 2018. During her medical career, her contribution to the profession is substantial. She has presented many abstracts and authored or co-authored over 22 publications in peer-reviewed journals. She has won many awards during her career, including the prestigious President's Award for Scientific Research in 2009 and 2017, Award for the Best Poster at the second annual scientific sessions of the Association of Sri Lankan Neurologists and the International Stroke Conference 2008, and the NRC Merit Award for the scientific publications in 2013. She has authored the book Stroke Care in English, which was then translated to Sinhala and Tamil. The book was recognized by the World Stroke Association and as material for education and published in the WHO website. Among many prestigious posts of voluntary organizations she has held, President, Sri Lanka Association of Geriatric Medicine in 2018 and 19, President, Ceylon College of Physicians, 2011, President, National Stroke Association of Sri Lanka, 2010, 2011, and 2012, President, Association of Sri Lankan Neurologists, 2008, and Vice President, SLMA in 2015, to name a few. She was a member of the board of directors of the World Stroke Association from 2008 to 2015 and an executive committee member of Asia Pacific Stroke Organization, again from 2011 to 2014. She held the post of chairperson, Specialty Board of Neurology, Postgraduate Institute of Medicine, University of Colombo from 2015 to 2018. And she is the chair, Specialty Board for Medical Rehabilitation, PCIM, University of Colombo, since 2018 to date. She has a special interest in stroke care and appreciably has contributed to uplift stroke care significantly. She pioneered thrombolytic program for ischemic stroke in the government sector in 2008 and thrombectomy program in 2018. She is the founder of the National Stroke Center, Mullaria Project, and the founder-president of the Stroke Support Organization for Sri Lankans. She was instrumental in establishing the practice of total risk approach for the prevention of CVD in Sri Lanka. During her leisure time, she loves gardening and reading mainly non-fiction books. She is married to Mr. Pushpa Gunaratna, an engineer by profession and a former Director General of Road Development Authority. She has 2 children, a son who is a healthcare analyst living abroad, and a daughter, a final year medical student at the Faculty of Medicine, University of Colombo. Patrons, past presidents, council members, members of Sri Lanka Medical Association, I am indeed honored and privileged to present to you Dr. Padma Shriyani Gunaratna, the 127th President of Sri Lanka Medical Association.
Congratulations, Madam. I would like to invite you to deliver the presidential address. Ladies and gentlemen, the President of the Sri Lanka Medical Association, Dr. Padma Gunaratna.
Dr. Amal Harsha, the Secretary to the State Minister of Primary Healthcare, Epidemics and COVID Disease Control, who is here representing the officials of the Ministry of Health, Professor Indika Karunatilaka, the outgoing President, Chairman and members of the Board of Trustees of the Sri Lanka Medical Association, past Presidents, Council members and members of the Sri Lanka Medical Association, Dr. J.B. Pires, my teacher in neurology, invitees representing government ministries, state institutions, academia, UN agencies, statutory bodies, international organizations, professional colleges, and academic colleges and associations, media, and all other distinguished invitees. Good evening, Ayubuwan, Vanakkam. I feel deeply honored and greatly privileged to be appointed as the 127th President of the Sri Lanka Medical Association. The Sri Lanka Medical Association is the apex professional organization of all medical professionals in Sri Lanka. Whether you are a medical professional in the public or private sector, young or old, practicing or non-practicing, graduates of local or foreign universities, specialists or grade medical officers, the SLMA brings all doctors together onto a single platform, enabling the establishment of a center of excellence for their continuous professional development. The SLMA is the oldest national professional organization of medical doctors, both in Asia and Australasia. It was established as the Ceylon branch of the British Medical Association in December 1887, with Dr. P.D. Anthonys as the president, along with 68 founding members. Along with the Declaration of Independence, the Ceylon branch of British Medical Association changed its name to the Ceylon Medical Association in 1951. The current name, the Sri Lanka Medical Association, was adopted in 1972 with the promulgation of the new Democratic Socialist Republic of Sri Lanka. As the leading professional academic organization for doctors for over 130 years, the SLMA's contribution to professional development of doctors in Sri Lanka is beyond measure. In this context, I consider myself to be ever so fortunate to represent this prestigious medical association as the president and be able to support the vision and the mission of the association. 2020 was a landmark year for the Sri Lanka Medical Association, being compelled to face numerous challenging health issues related to the COVID-19 pandemic that have engulfed the whole world with no continent or country being spared. I take this opportunity to thank the outgoing president, Professor Indika Karunatilaka, and his council for the unprecedented level of advocacy and activities that were carried out during this crucial period. While transforming the SLMA to face the challenges innate to a pandemic, many up-to-date facilities were established for virtual communication. These communication platforms now have become a blessing in disguise, in that they could be used to propagate distant medical education to all medical professionals, even in the most remote regions of Sri Lanka. As a result, the SLMA is currently able to promote distant medical education more than ever before. Medicine is a dynamic and an evolving field that sees developments due to the latest research and advancement in technology. While I appreciate that the primary objective of the SLMA is the professional development of doctors with a focus on promoting physical, psychological, social, and spiritual well-being to our nation, it's important that we understand that professional development includes the implementation of advanced knowledge, ensuring high ethical standards of practice. The SLMA holds a keen interest in both interest in health, whether it is the health of an individual, the health of the public, health related to a particular occupation, or even a zoonotic environment. To achieve its objectives, the reach of the SLMA has been intentionally broadened, resulting in 18 expert committees as well as 56 specialties under the umbrella of the SLMA Intercollegiate Committee. Out of the many activities that the Council of SLMA intends to embark on in the year 2021 under the theme Professional Excellence Towards Holistic Healthcare, there are several that represent areas of interest to me that I believe this august audience should be made aware of. Let me present them to you under the heading, A Drop Out of the Ocean of Medical Rehabilitation. The COVID-19 pandemic has been the worst global pandemic within my lifetime. So far, it has infected over 95 million individuals with a mortality of more than 2 million globally. Hitherto, there has been 55,189 diagnosed cases with 274 deaths in Sri Lanka. The pandemic has robbed many people of their livelihood and inflicted body blows to every strong economy all over the world. its economic and social impact on Sri Lanka is immeasurable. COVID-19 is highly infectious and has severe consequences, particularly in the elderly population and in people with multiple comorbidities. As at present, the management of COVID-19 is symptomatic, and measures of prevention is the key to control the outbreak. In this regard, the implied hopes of people on vaccination is understood and acknowledged, while all efforts to vaccinate people at high risk at an affordable cost must be prioritized. Along with the vaccination, other measures such as wearing a face mask, physical distancing, and frequent hand washing, combined with lockdowns for highly infected communities, will have to be in place long term to keep a surge under control. Measures taken to minimize infection among healthcare staff are absolutely essential. While continuing with economic development, living in this new normal will have to be encouraged long term. In terms of individual health, COVID-19 impacts the physical, mental, social, and spiritual well-being of people. While the physical and mental health impact of COVID-19 may remain for a longer than one would envisage, the psychological consequences of some others are a result of loss of their loved ones or of economic losses. Research shows that COVID-19 has caused an increase in family disputes, and it is likely that other non-communicable diseases may also show an increase owing to unhealthy lifestyle brought on with the restrictions imposed on the movement of people. In addition, COVID-19 convinces us how it could affect spiritual well-being of individuals. Certain communities were disturbed by the policy of essential cremation for all COVID-19 positive deaths. On the other hand, the projected economic growth for Sri Lanka is 3.4% in 2021. As responsible health professionals, it has to be emphasized that physical, mental, social, and spiritual well-being of people should be essential for the healthy economic growth of the country. Therefore, it's imperative that a wide range of rehabilitation measures are offered to all those affected in various ways following the outbreak. There are certain steps that have already been implemented by the government to reduce the economic impact of COVID-19. In terms of health, while realizing that there is vast room for improvement from healthcare to humanitarian care, the contribution that has already been made by the healthcare professionals along with the Triforces and the police is nothing but praiseworthy. It is in this perspective that I am talking about medical rehabilitation. Medical rehabilitation is a specialty relevant to a range of disabilities originating from any form of physical or mental disorder. The distinctive feature of successful rehabilitation is multidisciplinary team care. While appreciating the significant contribution made by the Sri Lankan Triforces and the specialists in rheumatology and rehabilitation in the field of rehabilitation of the disabled over the past several decades, I see medical rehabilitation as a specialty that is still in an evolving state of flux in Sri Lanka. Education on medical rehabilitation. Upon inquiry, it was revealed that many medical schools are short of a comprehensive and adequate education on rehabilitation for their graduates. However, patients under a range of specialties, including neurology, rheumatology, orthopedics, neurosurgery, geriatrics, ophthalmology, ENT, and pediatrics, require rehabilitation services. Within these specialties, stroke, spinal cord injury, cerebral palsy, cerebral infection, musculoskeletal disorders, visual handicaps, and impaired hearing are common entities that need medical rehabilitation. A research study was carried out with my hospital team to learn the practices carried out by varying levels of medical professionals with regard to stroke rehabilitation. The study included 110 medical professionals made up of interns, medical officers, registrars, physicians, neurologists in equal numbers. Their practices in regard to the varying components of stroke rehabilitation were inquired into. The findings revealed that all doctors believed that a multidisciplinary team care approach was useful in stroke rehabilitation, and more than 80% paid special attention to nursing and physiotherapy components of rehabilitation in more than 75% of their patients. However, only about 50% paid attention on all aspects of rehabilitation, more than 75% of their patients. The attention paid on occupational therapy, speech therapy, counseling, and the need for social services were considerably lower. The study further revealed that 65% of general physicians and 85% of neurologists would check for all aspects of the multidisciplinary team care on more than 75% of their patients, while the perspective was present in less than 40% of junior grade doctors. The implication of these figures suggested that medical rehabilitation was considered to be more a postgraduate subject in the medical profession, and that there was significant room for improvement of practices in rehabilitation. The SLMA's contribution to the development of rehabilitation medicine throughout its existence has been remarkable, with the most recent significant contribution being the report on disabilities prepared by the working group headed by the then SLMA president, Professor Lalitha Mendis, in 2008. Much later, and very much based on this report, the Ministry of Health published the National Guidelines for Rehabilitation Services from 2014 to 2018. The PGIM, Postgraduate Institute of Medicine, initiated the MD in Rehabilitation Medicine program for postgraduates in 2018 and has so far enrolled 8 trainees. The first MD qualified specialist in medical rehabilitation is expected to be board certified in 2023. In 2020, based on a proposal submitted by me, the SLMA initiated the Expert Committee for Rehabilitation of Disabilities as another step forward in the development of medical rehabilitation. Based on deliberations from this committee, we intend to take medical rehabilitation to its greatest heights possible in Sri Lanka. We intend to carry out SLMA-based skills development programs for multidisciplinary team members during this year. Rehabilitation of stroke victims. Cardiovascular diseases that include stroke is currently the leading cause of death in Sri Lanka. Stroke, which was the third leading cause of hospital deaths in 2013, ranked 7 in the year 2017. Stroke is the leading cause of adult disability, and an aging population further increases the prevalence of stroke as well as disability in the community. There are approximately 1,100 stroke admissions per year to the National Hospital of Sri Lanka, and this figure is about 1,500 at the Teaching Hospital Kandy. In a setting where we discuss ethics of equity to a great extent, the burning question is whether these patients get their fair share of our free health service when compared to other patient groups. Up until 1990s, there were no separate stroke services in existence all over the world. However, along with the stroke unit trialist systematic review published in 1993, which revealed the benefits of multidisciplinary team care in stroke units, stroke rehabilitation started improving globally. In keeping with the developments of the rest of the world, the very first stroke unit in Sri Lanka was established in 1998. Since then, the constant lobbying by the National Stroke Association of Sri Lanka, along with the Association of Sri Lankan Neurologists to the Ministry of Health, the result has been a significant improvement in stroke services. Our achievements over the last 2 decades are substantial. 99.8% of stroke patients in Sri Lanka undergo CT scanning of brain for diagnosis and management. As the consultant neurologist at the National Hospital of Sri Lanka, I was able to commence the very first thrombolytic program at the NHSL in 2008. Since then, the Ministry of Health has made thrombolytic recombinant tissue plasminogen activator for acute treatment of ischemic stroke available uninterruptedly. This costs per ministry about 200,000 rupees per vial. As at present, there are 17 thrombolytic centers right across the country. However, there are only 62 dedicated stroke beds. Dedicated beds for stroke patients are essential since, as known to all medical professionals in this audience, stroke patients sacrifice their beds together with their chances of recovery to many other conditions in medical wards. The mean duration of hospital stay for the stroke unit patient is 21 days, while it is just 3 to 5 days in the medical wards. About 9% stroke patients die in the acute stage, and another 16% die of preventable complications over the next 3 months following premature discharge. This knowledge led me, as the President of the National Stroke Association of Sri Lanka, to pressurize the government to establish stroke units for patients. As a result, the project on the construction of the National Stroke Centre Mulleriyawa was born, and it is comforting to note that upon completion of the construction of this project, the demand for dedicated stroke beds in Colombo district is likely to become somewhat eased. Along with this project, the government decided to establish 10 more stroke units in 10 different districts. Considering the rising elderly population and the increase in number of strokes, there is a compelling need to expedite the establishment of these stroke units. In keeping with the objectives of the government of Sri Lanka, in being concerned on equity of services, there is a vast need for development of stroke services countrywide. Accordingly, the SLMA Council will be paying special attention to improving stroke care in Sri Lanka in 2021. Let me now share with you my memories of some of the rehabilitation activities that I was able to organize through the various professional organizations in which I held positions over the past several years. We have conducted many stroke rehabilitation workshops countrywide. Here is the physical rehabilitation of stroke victims, that workshop conducted in Ratnapura in 2011. And here we celebrated the series of activities by organizing a series of activities in 2009 to mark the World Stroke Day. And for those activities, here I am receiving the Gold Award for the activities organized within that period from the President of the World Stroke Organization in Seoul, Korea. And this is the Asia Pacific Stroke Conference organized in 2011, and during all these conferences, there were workshops on rehabilitation. Physical rehabilitation of stroke victims, a training program for doctors and nurses in Jaffna in 2011. And stroke rehabilitation 2012, a nurses training program. There were workshops in Matale, Ratnapura, Mana, Vaunia, Batiklo, Jaffna, Galle, Batupitiwala, Sri Jawadanapura, and Kaluthara and Colombo, and I mean sort of almost in almost all important cities there had been workshops to train the multidisciplinary team care workers on stroke rehabilitation. And also we used to get the nurses from many hospitals that were with ideas of opening stroke units. And this is a training program for nurses on stroke unit care in 2013. Training program for nurses 2019. And again, we established the stroke support group or the stroke support organization for Sri Lankans with the objective of introducing the inclusive, to make inclusive community for stroke patients. And here is the stroke support group sharing the ideas in 2019. There was a neurorehabilitation conference organized in collaboration with the Sri Lankan Association of Geriatric Medicine in 2018, and within that conference we conducted the workshop for management of spasticity and also for rehabilitation of stroke and Parkinson's disease. And during the 5th Scientific Conference of the Sri Lankan Association of Geriatric Medicine, there were workshops on pain management and also for amputee rehabilitation. Right. To move on to geriatric services. The longevity experienced by all of us is an outcome of the improving health services in Sri Lanka. Better healthcare, along with the reduction in birth rate, has made Sri Lanka to be one of the fastest aging nations in the region. The elderly, defined as those over 60 years of age in Sri Lanka, stood at 6.6% of the total population in 1981 and rose to 12.4% in 2012, which is one of 100% rise over 30 years. It is projected that this figure will increase by another twofold to 25% by 2050. When countries with less than 45% of dependents, that is 30% below 15 years and less than 15% above 65 years, the United Nations Population Department defines that country to be in a demographic window. Sri Lanka currently is in this window of opportunity, or in other words, has the demographic dividend to achieve a rapid economic growth with a larger working age population compared to the population in the non-working age. An aging population will result in a decline in the working age population and an increase in the dependent population. According to the Department of Census and Statistics, the window of opportunity for Sri Lanka is expected to last for about 40 years, starting in the early 1990s. As such, it's prudent that the healthcare systems is able to anticipate an increase in the elderly population and address the challenges that would become a problem to the community well in advance. Have we been concerned on providing a reasonable service for the increasing elderly population? Is the medical fraternity adequately trained in delivering geriatric services? Is the infrastructure available sufficient to face these challenges? Majority of the problems faced by the elderly are unique to them. Some of the difficulties encountered by them include mental health issues such as depression and dementia, as well as falls, musculoskeletal problems, nutrition issues, incontinence, hearing problems, and visual handicaps. Unless there are well-trained multidisciplinary teams of healthcare professionals to take care of the issues of elders, we could become the victims of the consequences of poorly trained and underprepared systems. Similar to rehabilitation, do students learn geriatric care as an undergraduate subject? Upon inquiry, it revealed that the undergraduates are either not exposed or are exposed only to 1 or 2 didactic lectures in geriatrics. In 2013, the Postgraduate Institute of Medicine commenced a diploma in elderly medicine, and it has up to now produced 105 diploma holders. The MD in geriatrics was commenced in 2018, and there are 12 trainees in the training program as at present. The very first board certification of a specialist in geriatric medicine will occur in 2024. The program for the MD in old age psychiatry, which commenced in 2017, and with 4 trainees as of today, will complement the team of medical professionals dedicated to the care of elderly. As such, there is considerable room left for the SLMA for advocacy and training for the benefit of elders in Sri Lanka. The National Council of Elders, where I am a member, is the national body established to ensure the independence, care, participation, and protection of the rights of elders in Sri Lanka. The SLMA intends to work closely with the National Council for Elders and the Sri Lankan Association of Geriatric Medicine to provide advocacy for the benefit of elders in Sri Lanka. Rehabilitation of psychoactive substance users. As per National Dangerous Drug Control Board of the Ministry of Defence, there have been 89,321 drug-related arrests in 2019. The figures are likely to be much higher in today's context. Cannabis, heroin, methamphetamine, and hashish are the commonly used psychoactive substances. Out of all arrests, 51% were related to cannabis and 46% were related to heroin in 2019. The government and non-governmental organizations are providing residential care treatment and rehabilitation services for drug dependents in Sri Lanka. There are 4 residential treatment and rehabilitation centers as outreach programs for drug dependents under the purview of the National Dangerous Drug Control Board. The total number of reported drug users who had received treatment from these facilities for the year 2019 was 3,613. Heroin remains the main drug type for which people receive treatment in the country. All of them need weaning off of psychoactive substances and rehabilitation. The SLMA wishes to work in closer liaison with the National Dangerous Drug Control Board and the National Authority on Tobacco and Alcohol to overcome the drug menace in Sri Lanka in 2021. Use of novel psychoactive substances and legislation of old psychoactive substances are other upcoming challenges in this field. Novel psychoactive substances are compounds designed to mimic existing established recreational drugs. SLMA would be alert on all developments related to psychoactive substances. Services for rehabilitation. As highlighted, patients for rehabilitation have a range of disabilities and need the services of multidisciplinary teams of professionals. Irrespective of the disability, a well-rehabilitated person could contribute to the economic development of our country and would become an asset to the nation. As such, giving priority to the allocation of resources for rehabilitation would indeed pay off. Over the last several decades, keeping with the expansion of the medical specialties, there had been an improvement in numbers and the standard of nursing and allied health specialties. I take this opportunity to salute multidisciplinary team care professionals for their services, without which rehabilitating disabilities become impractical. lack of priority, particularly in allocation of nurses and allied health professionals for rehabilitation, is a challenge faced by clinicians. There is vast room for expansion of training to fulfill the need of these professionals in Sri Lanka. There's a need to improve infrastructure facilities for all the previously discussed fields, namely medical rehabilitation, stroke care, and geriatric services. One may question whether Sri Lanka can afford this much of infrastructure development at the same time in all these fields. Are we demanding the impossible from the Ministry of Health? Could we expect such a rapid transformation from a country like Sri Lanka with a GDP per capita of US dollars 3,852 and a 3.6% of gross GDP allocation for health compared to an 8 to 10% of allocation seen in many developed countries? Has the Ministry of Health, with 157,000 employees, provided us with the best possible facilities to perform? As an experienced clinician who worked in the Ministry of Health for over 3 decades, my personal opinion is that streamlining many areas in the Ministry of Health would save adequate resources to fulfill all these needs. Strengthening health economics, particularly on cost-effective, cost-benefit analysis of different treatment regimes and protocols in view of reducing unnecessary expenditure. Reform of primary health care by strengthening quality comprehensive, patient-centered and integrated primary health care. Appropriate shifting of institution-based rehabilitation to community-based rehabilitation. Intensifying population interventions for primordial and primary prevention of acute and chronic NCDs, and further strengthening of existing health information system are some of my thoughts of saving resources. They are worth considering. Achieving goals for SLMA. The goals of the SLMA cannot be achieved without teamwork and collaboration. The council appointed for 2021 is multifaceted, enthusiastic, and committed. I'm looking forward to working in collaboration with government ministries and state institutions, UN agencies, statutory bodies, international organizations, professional colleges and associations, trade unions, and also the general public. Let me conclude my presentation by humbly pledging once again that I'll be committed to serve you in my fullest capacity as the President of the Sri Lanka Medical Association to take the association to greater heights of achievement and recognition. I will be fervently committed to the motto of the Sri Lanka Medical Association, Lanka Dipassa Kitchesu Ma Pamaji, which translates to work for the good of Sri Lanka without delay. අද දින මෙම අවස්ථාවේදී සිංහලෙන් වචන ස්වල්පයක් කතා කිරීමට මම ඔබගේ අවසරය පතා සිටිනවා. මගේ කතාවේ පදනම වූයේ සාගරයක් බදු වෛද්‍ය පුනරුත්ථාපනයෙන් බිඳුවක් යන්නයි. කොවිඩ් වසංගතය ලෝකයමත් එමෙන්ම ශ්‍රී ලංකාවත් ගිලගනිමින් පවතින අවස්ථාවක පුනරුත්ථාපන සේවා කොවිඩ් හා සම්බන්ධ ගැටලුවලට මුහුණ පෑ සියල්ලටම ලබා දිය යුතු බව මාගේ අදහසයි. මේ සම්බන්ධව රජය දැනටමත් බොහෝ පියවර රැගෙන තිබෙනවා. නමුත් වෛද්‍ය ප්‍රජාවක් ලෙස අපද වෛද්‍ය පුනරුත්ථාපනය ගැන අපගේ අවධානය යොමු කළ යුතුයි. වෛද්‍ය පුනරුත්ථාපනය යනු කායිකව, මානසිකව හෝ අධ්‍යාත්මිකව ආබාධිත වූ අය පුනරුත්ථාපනය කිරීමයි. COVID-19 ආසාදනය නිසා ජනතාව කායිකව, මානසිකව මෙන්ම අධ්‍යාත්මිකවත් පීඩාවට පත්ව තිබෙනවා. මේ සියල්ලටම වෛද්‍ය පුනරුත්ථාපනය ලබා දීම ඉතාම වැදගත්. එමෙන්ම අපගේ වෛද්‍ය ශාස්ත්‍රයේ වෛද්‍ය පුනරුත්ථාපනය ශක්තිමත් කිරීමත් ඉතාමත්ම කාලෝචිතයි. බොහෝ රෝග ප්‍රතිකාරවලට වෛද්‍ය පුනරුත්ථාපනය වැදගත් වෙනවා. එබැවින් වෛද්‍ය පුනරුත්ථාපනයේ අධ්‍යාපනය නැංවීමත්, පුනරුත්ථාපනයට අදාළ මානව සම්පත් ශක්තිමත් කිරීමත්, ජටිතල පහසුකම් දියුණු කිරීමත්, පරිපාලනය ශක්තිමත් කිරීමත් වැදගත් වෙනවා. මෙමගින් ඉතා සුලභව දකින ආඝාතය වැනි රෝගවලින් පීඩා විඳින අයට සහ ආබාධිත වැඩිහිටියන්ට ඉතා විශාල සේවයක් සපයීමට හැකි වෙනවා. Acknowledgements. There are very many to whom I owe so much for all my achievements. I take this opportunity to salute my schools of primary, secondary and tertiary education. Dharmapala Vidyalaya Pannipitiya, Devalika Vidyalaya Boralla, the Faculty of Medicine, University of Peradeniya and the Postgraduate Institute of Medicine of the University of Colombo for the free education that I received. I wish to acknowledge the support extended to me by the Ministry of Health for all our activities during my tenure of 35 years in the Ministry of Health, particularly during the last lap of 14 years as the consultant neurologist, National Hospital of Sri Lanka. I thank Dr. B.J.C. Pereira for reading the script and all council members and the staff of SLMA office for the support extended. Big thank you to Mr. Champika and his team from Delmage Tours for managing the event. My childhood was with 5 siblings to whom I'm very thankful for keeping me happy. I'm in eternal debt to my mother, not only for her unremitting love and care, but also for the courage and resilience I inherited from a mother who brought up 6 school-going children following my father's sudden death when I was just 12 years of age. Last but by no means the least, I'm ever so thankful to my family, my husband, Pushpa Gunaratna, for being such a strength for all my activities, and my daughter, Preeni, a medical student at the Faculty of Medicine, Colombo, and my son, Pravi, and his wife, Watma, for their unstinted support and love. Thank you.
Congratulations once again, and thank you, Madam. Now, I would like to invite you to present the past President's Medal to Professor Indika Karuna Tilaka. Thank you, Madam. Our special performer tonight has yet another captivating performance in store for us. Ladies and gentlemen, please put your hands together yet again for the award-winning artist Sashika Nisansala.
Oh, ඔබ ස්පිය නොහෙලා බැලුවා මගේ දැස් දිහා මා ස්පිය නොහෙලා බැලුවා මා ස්පිය නොහෙලා බැලුවා මා ස්පිය නොහෙලා බැලුවා ඔබේ දැස් දිහා සංසුන් සිතින් සිතමි මුළුරේ පුරා දැනෙනා හැඟුම් විඳිමි සිහිනේ සරා දිගුරය දිගේ ඔබේ රුව මැවේ පවසන්න ලං වෙලා නිතරම ඔබ ස්පිය නොහෙලා බැලුවා ඔබ ස්පිය නොහෙලා බැලුවා ඔබ ස්පිය නොහෙලා බැලුවා මගේ දැස් දිහා මා ස්පිය නොහෙලා බැලුවා මා ස්පිය නොහෙලා බැලුවා මා ස්පිය නොහෙලා බැලුවා ඔබේ දැස් දිහා
Ladies and gentlemen, let's put your hands together once again for Sashika Nisansala. With this, we conclude the ceremonial induction of the 127th President of the Sri Lanka Medical Association. May I request you to rise for the procession to leave. We kindly invite all of you to join us for refreshments at the Sophia Hall in the main building of BMICH. We also kindly request all invitees to comply with the Ministry of Health guidelines and directly proceed to Sophia and take your respective seats. Thank you and have a great evening.